Hello, deep learners. I'm Andrew Ng, founder of deeplearning.ai, and I'm excited to welcome you to our global deep learning community. I know that many of you are here today because you want to break into AI and build your career. I hope that being part of this community will help you to do so. To give you a proper welcome, I'd like to show you around the deeplearning.ai offices and meet some of the teams so that you can see where it all happens.
Oh, hi, Andrew.
Do you want to tell our friends at Pine AI what you do at deeplearning.ai?
Sure. Hi, everyone. I make articles and other media that help people learn about AI and help them understand the huge impact that AI is having in the world. Today, I'm putting together the next issue of The Batch, our weekly newsletter, and I'm looking for the biggest stories of the week to keep our readers informed.
What's been the most surprising thing you've run into working on The Batch?
How much is going on in this field? There's never a dull moment. You might think from the outside that machine learning engineers really understand everything about AI, but nobody understands everything about AI because this field is just coming to life right before my eyes as I put this thing together every week.
All right, I know you're really busy, so I'll let you get back to it.
Thanks. See you later.
Let's go meet Kian, who helped me create the deep learning specialization. He's working on an exciting new project. Hey Kian, so do you want to tell the people at Pine AI what you're working on?
Yes, sure. I'm leading a project called Workera, focusing on helping people get offers in AI and navigating their career by testing their skills, preparing for interviews and certifying them, as well as matching and referring them to good jobs in AI.
That's really cool. And what's the most exciting part of your day?
You know, the AI field is new, organizations and jobs are still misunderstood. So I'm excited to help people understand what different types of jobs exist in the field, what tasks they will work on, and what skills are needed to achieve those tasks.
That's really important work. Well, it's nice chatting. And now let's go chat with Hotel, who is on their product team.
Hey, Andrew.
Do you want to say hi to our friends at Pine AI and let them know what you're working on?
I would love to. Hi, everyone. I lead the product team in deeplearning.ai, where we create AI education content accessible to people all around the world. People like you.
And what are you most excited about right now?
I am so excited to see our community grow and to see how eager people are to learn more about AI.
Thanks, Hotel.
Thanks, Andrew.
So, as you can see, our team is working hard to support you and help you learn. It's never been easier than before to break into AI. So if you want to build a career, you can leverage online resources available, including open source code, datasets, papers, and online courses like a deep learning specialization on Coursera. As part of this journey, I hope you get your hands dirty too. Don't be afraid of diving in to build your own project. Or go ahead and try to replicate a research paper that you're excited about. One thing that I've seen help a lot of people succeed is if you can build a community or find a community of fellow deep learners you can meet with and study with on a regular basis. In fact, I hope that this Pine AI meetup that you're at right now will be a good place for you to meet these people. I hope you enjoyed the event today and that you learn a lot, both from the talks and from each other. And once again, welcome to the deeplearning.ai community.
Hello, everybody, and thank you very much for joining us for another exciting Pine AI webinar. We're going to have a little bit of a different flair this evening. Instead of having a formal presentation, we're actually going to be having more of a fireside chat. I want to thank, again, as always, deeplearning.ai for sponsorship for these events. I'd also like to thank Eastern Virginia Medical School, who has invited us to give this special talk to their medical students. And I'd also like to thank our partner, Halo Space, which is also live streaming this across their channel. So thank you all for joining us this evening. I'd like to bring together now our panelists that will be speaking on these several subjects. First, Dr. Tayab Waseem. Tayab, perfect. Thank you so much. How are you doing tonight, Tayab?
Doing great. How are you?
Good. And for those of you who haven't seen our esteemed colleague on several other kind of occasions and talks and even documentaries that we've done together, Dr. Waseem is a PhD immunologist at Eastern Virginia Medical School. He's also currently in medical school. His career is diverse in background, as you would expect. He's the Chief Scientific Officer for Stability.ai. He also helped direct the White House Office of Science and Technology Policy Project from a clinical perspective with CAGL called CORD-19. He sits on several advisory boards, both private and governmental. He's worked with the UN on partnerships for global data access frameworks, as well as the WHO group for regulatory considerations on AI and healthcare. All on top of going to medical school, Dr. Waseem. I'm not quite sure how you do it all.
Helps that it's online this time.
I'm sure it does. I'm sure it does. And Dr. Waseem is also the one who set up this evening's talk with EVMS. Tayab, would you like to give a little background on who is our audience tonight and who are we going to be speaking to?
Yeah, so this was really spearheaded by two clubs at EVMS, the Evidence-Based Medicine and Research Club, as well as the new Informatics Club. And really there was a lot of interest both from medical students as well as residents and attending physicians on getting involved in this new space as we've seen it take off with COVID-19.
That's awesome. So special thanks to those interest groups and to EVMS. I'd like to bring on our next panelist now, Dr. Richard Minassi.
Hey, Jose, how are you today?
Hey, my friend. Good. Rich, how are you doing, buddy?
Doing all right. Beautiful day here in Tampa, Florida. Can't complain. I think we're hitting the low 90s. So summer is here, whether we like it or not.
That's nice, man. Here in Virginia, we had a nice day too. It was a little overcast, a little light rain, but for the most part, it was cool, kind of in the low 80s. So can't complain from that perspective. But I'd like to introduce you to the audience. There's a lot to be said for Dr. Richard Minassi. He's a good friend and a colleague. I met Richard when we were working together at NASA iTech. For those of you who have not heard of iTech, it's an accelerator focused on helping solve the 2030 Mars mission objectives. So it's a NASA accelerator trying to bridge public and private partnerships to solve those solutions that NASA still has. Deals a lot with human health, but really it spans the gamut in technology. Dr. Munassi is obviously a medical physician, as you see here, but he's gotten his MBA, and he's worked really in entrepreneurship and in innovation his entire career. He's worked with several startups, worked from ideation stage to growth strategy and exit stage. He currently is a co-founder. He has several startups that he's a part of, but Blackfin, he's also raising a venture capital fund for biotech, and working on some amazing technology that involves AI, but really everything that has to do with deep technology, emerging technology, not just in healthcare, but in other sectors as well. Richard, is there anything else you'd like us to know about your just historic milestones that you've met throughout your career?
Yeah, absolutely. No, I think you hit it all on the head. Pretty involved from both a heavy regional perspective, Gulf Coast, so involved with TMCX out of Houston, Mass Challenge out of both Houston and Boston, and then as well, of course, the Tampa Bay Wave, where I'm the director of a technology accelerator that helps early stage tech companies move quickly from essentially ideation stage through exit. A number of our companies have done quite well for themselves in the healthcare space as of late. In fact, if you look at the portfolio for the Tampa Bay Wave, I basically handpicked every healthcare company that's come through the program in the last 3 years. A couple of notes: Hoy Health out of the New York, New Jersey area, Neuroflow, which is out of Philadelphia. They just closed a Series B of 20 million, focused on mental and behavioral health. And then also Immertech, which Dr. Morey is on the advisory board on. That is a company right here in Tampa. Met them when they were about 3 guys. They were just developing a virtual reality platform focused on training surgeons in the operating room. They are currently getting ready to do some pretty big things that I can't say on camera, but it's going to be a great year for them in 2021. That's just a small number of what keeps me busy for my day-to-day. As Dr. Morey mentioned earlier, I also am in the process of setting up a venture capital fund focused on healthcare technologies either located in the Gulf, having gone through an incubator or accelerator in the Gulf, with an anchor client in the Gulf, or spun out of a university in the Gulf. But that being said, very happy to be here today to try to add to this conversation with this great group of physicians here in the room, and one physician on the way in the room, and then also share anything I can to help all of you here joining in along your journey when it comes to technology and healthcare.
Yeah, so for anybody that's listening to this right now and everybody here at EVMS, Dr. Richard Minassi, look him up on LinkedIn. He's very active and popular there. He's a person that you can connect with, that he's always willing to help out. Obviously, he's very busy, so if he doesn't reach out back to you, give him some time. But there are plenty of startups, plenty of mid-stage startups, early-stage startups, and late-stage startups in health tech. And these are the kinds of things that I know are really interesting to the people we're talking to. They all have machine learning and data. Everything involves data nowadays, but obviously AI to different degrees. So all these things are the different types of things that you can be involved with, not just from medical school, but after you graduate. There's so many things you can do with your career. Yes, you can go into front-end medicine, and you can do a residency and a fellowship, and you can be doing those kinds of things, but there's so much more that you can do, especially in today's day and age, that we really need MDs that are being involved in the tech space. We need more. It's kind of a bit of a soapbox of mine, because we come from a very different ethos than your typical engineers that are going to be coming out of Silicon Valley or other kind of areas. They don't have the mindset that we have when it comes to how we take care of patients, the things that need to be done. And then also, if you actually start working within healthcare, the understanding kind of the politics and the way healthcare works, the way reimbursement works, the types of logistics and workflows. These are all things that technology companies, from AI to whatever, are looking for. So there's a lot of value if you're in an MD going into the space. And the way that we're taught to be critical thinkers is very different than other kinds of industries and other kinds of educations. So we actually have a very unique skill set when it comes to ideation and trying to solve a pain point, which is what innovation and startups are all about. But we'll go ahead and get started from some of the questions from the audience. And this is on YouTube Live as well as many other locations right now with our partner Halo Space. I'm going to start with the first question here. So from the audience, we had some original questions. Tayab, I'll give it to you first, and then Richard to you. Tayab, you're actually working. You're a medical student, and you're working in really cool projects. So I think you're the poster child for what this whole conversation is about. But in your perspective and from your experiences, what are some paths to find an AI expert who will collaborate, or a technology company who will collaborate with medical students? How did you start your journey, and how's that been, and how can other people learn from you?
Yeah, so I think it all starts with just being informed. So, the onus is on you to prove that you're actually passionate about the field. I think if you go to somebody who's very, a diehard basketball fan, they'll name you every coach in the past 20 years. If you say you're actually, passionate about doing tech and medicine, you should know who the big names in the field are and what they're working on. You should know who Daniel Kraft is, the chair of a university, or different folks at Stanford High. But then once you kind of have the big names, then you can start attending these conferences, because where they're talking, and at these conferences they're going to be doing the most innovative presenting. So you'll be on top of the field, and you'll know what's actually going on, so that when you actually have these conversations with the folks who actually are very excited to meet people coming into this space, there's not very many people working in the tech medicine space as big as it's gotten. And so they get very, very excited when you're actually passionate about it and are starting to join this new ecosystem. I'd say create a LinkedIn. I think that's something that most everyone does Doximity in medicine, but if you want to get involved in outside of pure medical space, get a LinkedIn. And then after one of these conferences, after watching these talks, a lot of big guys will put their email address and say, hey, here's a project I'm working on. I'd love to have help on it. And unlike just pure academia, in tech, they actually pay you for your work. So, nobody works for free in tech, and they'll pay you to come just use your skill set, whether it's looking through charts or evaluating a product and testing it out. Send them a message. And, don't be afraid to double ping them. You'll double text, double email, triple email them. They'll get back to you eventually.
Richard, how about in your experience? I mean, why don't you tell a little bit about how you came to do what you're doing? Because you did not do a residency, correct? You went directly into tech, into innovation, and you've had an amazingly successful career. So, how did you come to that decision to do what you did? And then, how do you seek out medical students or other clinicians? And is there a need for more, in your opinion?
Yeah, absolutely. First thing I'll say. Everyone gets paid in tech. Good for me to know that because I give a lot of stuff away for free. So I'm going to start charging that out. No, I'm just kidding. Anybody, by the way, anyone who wants to reach out to me, you should be able to get my LinkedIn as well as my email address sent over into the chat for the viewers. Feel free to reach out anytime. First and foremost, I kind of fell into tech. It's kind of funny. I didn't think I was going to go down this route. When I was wrapping up my clerkship training in Atlanta, I 100% thought I was going to go down the hospital administration route. In fact, I was in Los Angeles and I was part of ACHE. I think I was one of the youngest interns/fellows, maybe in the regional history. Worked very closely with CEO from DHS over there. And then while all that was happening, I had a friend from Minneapolis tell me about a friend of his who was moving to California out of the blue, and she didn't know anybody. She knew that my background with regards to the region is where I grew up. We lived there for a number of years. They said, hey, look, do you want to meet her? She's working on like a website or something. And I said, yeah, sure, absolutely. More than happy to help her out, get plugged in. That ended up being a tech startup. She was literally getting it up and off the ground. I helped her. That did quite well. We worked on it together. It ended up getting taken off the shelf in a very nice little acquisition. No complaints on my end. When that happened, I thought, holy cow, this world's pretty awesome. I did go to undergrad at UC San Diego and basically was surrounded by computer programmers. So I knew the world, but I didn't realize how much I would get into it. Thought I would always be kind of tangentially involved. But I got to tell you, after that first startup and the next couple of ones, I was all in very, very quickly. And it's what I've been doing for the last 12 years, primarily out of the southern part of the United States, since I hate snow. So out of California, Texas, and in the Tampa Bay region. Along the way, a couple of different companies in medical diagnostics, medical education, a small play into biotech in there, as well as travel and entertainment and media. Current company builds software for hospital CFOs. That company has deployed to some of the largest hospitals in the US. We have multiple top 25s at the CFO level actually leveraging our software currently. But my give back is really to the community. I'm very, very bullish on healthcare and technology. I have been for several years, especially around the Gulf in particular. And I do have to tell you, I think the future is bright with regards to healthcare. And though COVID has unfortunately been a black mark on the history of our country and how we have handled it and the response and the high death toll, and even now how people are reacting, it did do one thing, and that's it kind of woke people up to the transformation that still needs to happen in healthcare. And there's been some great things happening quite quickly in the last 6 months to a year that I'm hoping continue to build up momentum over time.
That's amazing. And we'll put some of these companies into the chat so you guys can see what's going on that Richard mentioned a little bit later. Blackfin is one of the companies he just referenced. Oi Health he referenced earlier. Immertech. MedZoomer is perhaps not one that you mentioned, but it's another one that's out there as well. I think you mentioned one more. We'll put all those there. And then Tampa Bay Wave is his accelerator. And I would echo both what Richard and what Tayab said. Reach out. So if you get both groups, it's kind of like those old sayings, by your friends, you kind of know yourself, or birds of a feather kind of thing. So if you only go to medical conferences, you're only going to know your network is only going to extend into medicine. If you want to get into tech, if you want to get into AI, you have to leave what you're comfortable with. You have to leave your comfort zone and go to those places that the technologists are going to be, that AI specialists are going to be. Now, there are some things that straddle the fence. There are some organizations that are healthcare oriented that also do some AI and tech. For example, SIMS, Side of Imaging, Informatics and Medicine, which is radiology focused. They do a lot of AI, but realistically, those tend to be very few and far between. Really, you want to get out on those IEEEs. You want to go to the South by Southwest. You want to go to those conferences that have a lot of tech space. And the reality is that you're going to be a diamond in a rough for them there, because you're going to be so unique. The fact that you have an MD, because just as much as anyone that's listening to this wants to be involved in AI and wants to be involved in healthcare startups, they're the same way. They don't know how to access you. They have no idea how to find you. So going to them is really one of the best ways that you can be involved with these kinds of things, because if not, then you kind of encircle yourself. And I was the same way. I didn't realize that I wanted to do this. I thought I was just going to go into private practice. I thought that was going to be my career. That's always kind of what I envisioned once I started studying medical school. And it really was towards my end of my residency where I started getting enamored with data analytics. That's really where kind of my journey started. And then that opened up the opportunity to go work with IBM. And then once I started going out to IBM, which was in San Jose, I started getting involved in the whole ecosystem that's out there between Silicon Valley and San Francisco, Menlo Park. And that's really where all of these networks and connections started kind of taking me down different paths. And honestly, be willing. Yes, Tayab it's nice if he gets paid for everything starting out. It's amazing. You might not always get paid starting out, but that's still fine. Be willing to go out and be willing to explore. And besides Eastern Virginia Medical School, I'm sure others are going to see this. And there are a lot of opportunities, even within your own facility and ecosystem. Here in the Hampton Roads area, there are other universities and other things that are going on. There are a small growing kind of bubble and ecosystem. So explore what you have in your community. If you're in Philadelphia, if you're in Austin, if you're in Atlanta, if you're in Miami, not every place has to be Silicon Valley. Not every place has to be New York. Take advantage of the networks that you have in your location. And then when you go on and you meet new people, leverage those and start learning those. And that's why things like LinkedIn are very important. Doximity, as Tayab said, you're just going to meet physicians. If you go out to these other kinds of social media outlets, then that kind of expands your network. So those are the kinds of things that you need to be leveraging, but you are very valuable to the tech sector because they need that expertise and they are looking for that expertise, whether it's kind of starter types of things like going through charts or whatnot, or whether you get to the point where you are a chief medical officer or you are on an advisory board or a CAB. Where you're actually ideating and you're strategizing what they should be doing in product development. And all these things are skill sets that you will develop over time. All these things, you'll see them as you go through the process. Go out there, go to hackathons, search for hackathons in your local area, or perhaps one that you can drive to that's in a bit of a bigger city, and be involved with those things because it builds to your ecosystem. And then you'll start getting to know people that can code or people that can do social media or people that have very different skill sets. And when you put diverse people from diverse backgrounds into something like a hackathon, that's where innovation happens. And that's where you really start getting really novel solutions to things. So stretch your boundaries, go beyond what you have, go beyond what you're normal. Medicine is very unique in that it's very paternalistic and structured, and we've done it the same way. It's that whole apprenticeship thing, and you're going to go into your first year, the second year, when you're going to take your steps, and then you always kind of know 1 or 2 years ahead of time what you're going to be doing for like 3 to 5 years, right? Tech entrepreneurship, it's not like that. The startup kind of scene, it's not like that. You have an idea, you're building, you're doing this really fun stuff, and then you're pivoting, and it's things aren't kind of scripted for you. But you can learn certain skill sets that will help you be more successful, have the probability of success be higher when you start developing these things. But it's a very different type of level of comfort that you have to get used to be able to be kind of in this ecosystem. So you have to be comfortable with that. Our next question that we have from the pre-ordained questions here. Tayab, again, to you first. Is it realistic for a medical student to become competent in AI within a short period of time?
I think you hit the nail on the head right before this, Jose. I don't think you have to become competent in AI. I think your skill set is leveraging what you know about healthcare or about medicine, and going to these other tech companies, because at the end of the day, they're going to code circles around you. They don't need people who can code. What they need is people who understand healthcare and even just basic terminology for them of, differentiating one word versus another or one study versus another. I think that's where your power as somebody in the medical field is. So I wouldn't necessarily take all the time to go out and learn coding. If you want to, I think Python's a fun one because the syntax is easy and it's easier to learn. And it does help you understand what everyone else is saying in the room if you have a basic grasp of coding, but I wouldn't focus my time trying to become, a master coder.
Do you code? Do you know Python?
I do. So my background was in computer science, but I'm a garbage coder. And anytime I have to hard code something, a group of programmers will go in behind me and my 100 lines of code will still turn it into 10 and make it more efficient. And I just learned that if I have a general idea of what needs to get done and I can explain it to them I know what the code should do, but you can do it better than I can. And here's the output on the medical or research side. They'll be able to make that happen. And because you can kind of speak both languages, it works really well.
Yeah, that's a really, really good statement. I don't know if I would change anything of what he just said. Here's the truth of the matter. All of you here watching this chat have lived your lives to get to this specific point of being medical students, maximizing your opportunities to break into healthcare. And that's awesome. Understand that the people that are out there working in tech that are hard coders, for the most part, have been doing the exact same thing their whole life, but focus specifically on coding. And no matter how good you try to get, you're always going to be 10 and 12 years behind. And in the process of you trying to catch up, they're just going to continue to be 10 or 12 years ahead of you. And that's a hard truth. And there's nothing wrong with that. In fact, I just had a conversation this weekend from a former partner at PricewaterhouseCoopers, incredibly brilliant guy. And he told me, I'm going to build this and I'm finishing up. He's doing a master's in MBA. And he said, yeah, at the same time, I'm learning to code and I'm going to kind of stand this thing up. And I just asked him, I said, how good do you think that whatever you're going to build is going to be? And he goes, well, it's going to be good. And I said, it's not. I guarantee you right now, it's going to be terrible. And that's okay. There's nothing wrong with that. You don't have to do everything all the time. And you certainly will never be the best at everything at all times. It's a hurdle. For some reason, I see PhDs and MDs who are launching tech companies, they continue over and over again to have this thought process that they can just do everything themselves. When the truth of the matter is, this is a very hard world to explore, to really understand how to build, launch, and grow a tech company. That is a unique skill set with unique critical needs that need to come from human capital. And no one person can do everything, right? Steve Jobs had Wozniak, right? Mark Zuckerberg at Facebook had all those guys he ripped off, and Eduardo. And the list goes on and on. There's always more than one. Even Bill Gates, he had Ballmer and the rest of his guys up at Microsoft. And the truth of the matter is, you are best served understanding what you're an absolute subject matter expert at that is in high demand, and that is healthcare. But where you can add significant value in a small period of time is understanding how to better communicate within the tech sphere, understanding how the world of technology works, ensuring that you have a baseline understanding of what helps a company get up and off the ground and through their pre-seed, seed, Series A, what that pattern is, because so much of what we do on the tech side, whether it's healthcare or any other vertical, is pattern recognition over and over again, whether it's by somebody like me, whether it's by other investors, whether it's by people looking to work with you or work alongside of you, whether it's people that are at tech companies that are looking to hire you. Everyone is looking for patterns to mimic success and figure out the path of least resistance to make a large impact, both in healthcare, both in product, or even financially. So just something to kind of hope you all keep in mind. Go to those conferences. I'm on the advisory board for South by Southwest. I've held that role for a number of years. Do it. Go to all of these conferences. Really get out there. Learn to meet people. Get in front of others. Say, hey, look, I have an interest in technology, but do your due diligence on not just the companies and people you're interacting with, but also on this world and how it works. And I'd be more than happy to recommend a couple of books in the chat that will help you get a nice baseline of things that you should know that are just the most simplistic things, period, with regards to understanding how, the language, the patterns for growth, etc. But please do your diligence. Understand exactly where your particular puzzle piece fits into things. You're going to do just fine, no matter whether it's healthcare, whether it's technology, whether it's government, no matter what it is. As long as you understand how things work and you do your diligence, you're going to be just fine and successful in it.
Yeah, great words. Great words of wisdom from both you guys. Thank you. And I would echo the same thing. It's very few and far between in which they're going to any MD is going to have to do any kind of coding. The vast majority of people that have an MD are going to be brought in for that particular skill set. They're not looking for your skilling, your coding skill set. The only time that you would want is if you're embedded with a team that's doing a lot of that. But again, it's going to be a handful of positions that have both those skill sets. It's going to be very unique to be doing that and to play that role. But if you are interested, yes, the things that you want to learn, if you want to code things on your own and you want to do your own thing, Python is pretty typical for AI. Right now, it's kind of a very easy language to learn. There's a lot of online courses that are free, whether you want to do like a Khan Academy or edX or Udemy, or there's plenty of them out there that you don't have to pay for, that you can learn introductory kind of coding, and you can just download everything for free and take courses. You can always pay to get certified in it if that's something that you want. IBM has courses as well that are free. That you can take. Google has free courses that you can take. So does Microsoft. So it's getting very, very popular to have these online courses. And a lot of people are utilizing them to upskill, which is very important. So, but it's not something that is definitely going to be required for 95% of physicians to get into this space. Now, I'm a strong proponent that we should all understand code to a certain degree, but that's my kind of STEM education background. That I think it should be a second language, just like French or Spanish or whatever else we teach in schools. I think coding is something that we should teach in school for everyone, because especially from the healthcare perspective, eventually AI is going to be ubiquitous, and we're going to be using it in all sorts of diagnostics, and even in some therapeutics as well, potentially. And realistically, it's going to be like, just like when you guys learn about CT scans or MRIs or different blood tests, you're going to want to know what's the limitations of those things. So understanding those kinds of things is very important. It's more, I think, if you understand the data, like where the data is coming from. The other big thing is to make sure that as these AI applications are being developed, that we're not bringing along systemic inequalities that were baked into kind of the data set that they learned from. So understanding that sometimes that can induce or perpetuate inequalities, those kinds of things you should know about and you should educate yourself on. Just like with anything else, if you have a patient, you have to understand their cultural perspective to see how you're going to treat them. You have to understand their socioeconomic background to be able to understand what kinds of things they have access to. Those are the kinds of things that you need to be understanding and bringing to the table. One question from the pre-recorded questions, and then we'll start taking some questions here from the audience as well. In your guys' perspectives, Richard, I'll start with you this time. What do you think is going to be the biggest impact of AI in medicine over the next coming years?
So, it's a great question. I think there's a lot of different areas that AI is currently impacting healthcare and will into the future, everything from radiology to analytics. But I actually think the impact on the pharma side is something to watch very, very carefully with regards to clinical trials, with regards to drug discovery. I think we are about to enter a renaissance when it comes to drug discovery in general. And I think that the leveraging of AI and data and machine learning all within that sphere is going to really shift how health is impacted via new drug discovery well into the next, I don't know, maybe the next 20, 30, 40 years. That is what I'm certainly most excited about. But that being said, I mean, cancer recognition, breast cancer in particular, I think early findings of that, I think, is something that's coming up very quickly too. But my eye is specifically on pharma, and I got to tell you, I'm pretty excited about it.
Tayab, what about you, buddy?
I mean, I love looking at the back end of medicine there with like AlphaFold and how it's going to change just drug discovery. But I actually think the biggest transformation that is going to happen is with mobile health. I think, everyone loves to, get on digital and telemedicine because of the digital divide that currently exists. But when you think about mobile phones, most of the world has access to mobile phones, and therefore all these new applications and devices that plug into it are going to bring healthcare to hundreds of millions of people. And then on top of that, it's a technology that everyone already has. So you're not trying to ship out new products to people. And the tech's getting better and better. There's one company I work with who is doing vital signs through the cell phone on the camera, or integrating that into a Zoom chat. And as you have seen that, the Medicare has kind of loosened up its guidelines on what they're going to reimburse. Insurance companies have loosened up their guidelines on telemedicine, which were frankly just antiquated. And I think that's going to be the biggest push, at least in the next 2-3 years.
Now, a follow-up question to this, Tayab, and then back to you, Richard. Where do you think this innovation is going to be coming from? Do you see it most from the U.S., or do you see another location kind of being the tip of the spear when it comes to this type of stuff?
I mean, Miami's kind of becoming the new Silicon Valley with the way they're incentivizing people to move there. I think the U.S. is a leader in the space. China has always been at the forefront of this. But they're very good about kind of keeping theirs enclosed within their ecosystem, whereas the things that are developed here tend to proliferate globally much more quickly.
Yeah, I would say the U.S., to be completely honest. I think you need to watch the military sector as well. I think there are things that are happening, and Dr. Morey, I know you and I both kind of play a little bit on that side. So there are things that we've seen that won't be in the commercial sector for a number of years that are very impactful. But I would say the U.S. first and foremost. Let's be completely honest. This is a capitalistic society, and at the end of the day, a lot of what we do in the startup world is around generating revenues, and a lot of value comes to that. And to the winner goes the spoils. And based on that, I think that's why also historically you've seen a lot of great healthcare breakthroughs come out of the US. We are incentivized as physicians and as innovators to push the needle all the time. Sometimes it's good with regards to new medical devices, with regards to new drugs moving faster. Sometimes it's bad with regards to Theranos, for example. But it really comes down to this. At the end of the day, none of you here in the room are 19-year-old Stanford dropouts that are playing in the world of healthcare. You are physicians and physicians in training. You take this seriously. You will solve these problems. And I will 100% be more than happy to support you in any way that I can. But remember that and keep that top of mind. The things that you learn and you practice every single day, the problems that you're looking to solve, go out and solve them. No one's going to do it for you. And certainly we cannot leave it in the hands of people that don't take healthcare seriously, that don't take the patient population seriously. And that blend of healthcare, the caring for the patient population, plus the drive to make an impact can certainly do great things when it comes to healthcare today and tomorrow.
Yeah, great words of advice from both you guys. And I'd like to foot stomp that last one from Richard. It was physicians who wanted different types of insurance policies and different types of reimbursement kind of structures to be developed, but they didn't want to have that discussion. They didn't want to be a part of the solution when managed care was coming into the fray. And now I'm sure when you guys talk to your attendings, we hear it all the time, because I still practice part-time. You hear it all the time. People are always complaining about reimbursement, having to deal with HMOs, and especially if you have your own clinic. But the reality was we weren't at the table when those decisions were being developed. And there's that old adage, if you're not at the table, you're on the menu. Technology is the next big disruptor. It's the next big dislocator for the industry. And if we are not actively engaged in those discussions, then yes, we could be disrupted in ways that is A, not beneficial to the patients, and B, not beneficial for us as well. And like I mentioned before, we have a very different perspectives on the patient than someone who's just coding ones and zeros that they will never have, because they're not on the front line and they're not the ones to see the ramifications of what happens when you make a mistake, or what happens when you make a decision that's not just life and death for one individual. Life and death touches an entire family. You see those ripples throughout an entire neighborhood or community, depending on the individual. What we do is serious. And in the tech sector, it's a lot of try fast, fail fast. And that's great for innovation. But when you do that with a human life, it's a very, very different perspective. And speaking of the military, that's one of the interesting things about military innovation, that they come from a very similar perspective as healthcare, because they understand the ramifications of making these kinds of life and death decisions. And that's something that Silicon Valley will never have. And that's, in my opinion, the greatest value that you bring to the table with these kinds of healthcare startups. Let's take a question from the audience. Bertie, if you can put that question up. So Surya Gorneni, I apologize if I didn't say the name correctly, but all of you have amazing experience in starting companies and working in startups. What are the challenges you faced when you started, and any advice on navigating those? Richard, why don't you take that first, and then Tayab?
Sure. The challenges faced when started, the biggest one is get out of your own way. Realize your place in things. I think all of us have made that that mistake, especially when I think about the other peers that I have that are physicians, that when they first jump into tech, it's automatically, well, I can solve any problem and do anything. Once you can kind of get over that hurdle and understand how to deal with people as well, that is a critically important skill to have if you're playing in the technology sectors, understanding different personalities. Programmers, very, very unique human beings. Tayab, I know that you can attest to that, I'm sure. And then the business side of things is very different as well. So, understand how you fit, and then also do your diligence prior to any engagement, period. I can tell you one of my earliest startups, I was at a conference, and I won't say the name of this, but a major Silicon Valley venture capital firm, I'm talking top 5, came over to me and started talking to me about my company. I had no idea who they were. I was unprepared. I was very, very young. And they showed interest, and we didn't really take it seriously. And now I think backwards, I'm like, man, that was a golden opportunity that I didn't pounce on because of my lack of preparation. And that's something that I recommend all of you. Really immerse yourself if you're going to jump into this world. Don't jump in with just a toe in the water. Do your diligence and homework. Understand who the players are, how they can be impactful to you and your career. Get an understanding of where you would like to start and where you would like to finish, whether that's being on the founder's side, a chief medical officer, a chief scientific officer, whether you want to play in the venture capital world, private equity, the list goes on. And then from there, ensure that you are fully prepared to get from point A to point B. And then lastly, really leverage people around you. There's so many wonderful people in technology and in healthcare that are willing to help you along your journey. Do not be afraid to ask for advice and thoughts, and do not be afraid to reach out when you need help.
Tam?
I have to echo the due diligence one. The number of meetings I walked into where I didn't realize this is the CEO of a Fortune 500 company, and I'm just casually addressing him and don't actually know what they actually work on, was pretty embarrassing. I'd say understanding the lingo of when you start going in front of VC firms, when you start hearing about non-stock options or equity, and all of these just words start getting thrown at you. I think it's okay for you to reach out to others and ask them for help, and say, hey, here's the new world that I'm diving into. I'd love to get advice. I've called Jose plenty of times throughout this experience of, here's a company I'm working with, here's what they're offering. Do you think this is the right way to approach this situation? And then, those that are actually in this world really, really want other people to join this clan. If you do actually do your due diligence and know what's going on in the field, they will be more than happy to give you mentorship and guidance and show you, hey, here's a project that's up and coming. You expressed an interest. I'd love to get you involved one way or another. But you really can't do the shortcut on the homework. The last thing you want to do is be speaking to somebody who's, the founder of a company, and you give them an idea that's something they're already doing because you didn't do your homework.
Yeah, and I would echo again what Tayab said. Find mentors. That's true in life for everything. But if this is something that you're really passionate about, seek out those mentors. And then once you start having some success, then make sure that you also pay it forward and kind of build people up. It's a very important thing just in general to do in life. Let's do another question from the audience. This is from Urjay Andrew. Hello, everyone. I'm excited to hear about AI, ML, medicine, expanding role of technology in healthcare. In your opinion, do you believe telemedicine will fade post-pandemic? Tayab, since you talked about mobile, why don't you take this one first?
I am confident that it is here to stay. A lot of these outdated, antiquated guidelines that got put in place when HIPAA was first written had no idea what actual security looks like when it comes to getting information from one place to another. Now that insurances have started reimbursing it, I think that's another driving factor for keeping it around. And I might be wrong about this, but I'm pretty sure Medicare has also signed off on getting after telemedicine. And honestly, I think a lot of providers are now adapting to be able to provide telemedicine on a regular basis and screen patients so that they can send them back if they need to in office. I spoke to a physician who called the officist. So they see the patients as a pediatrician, and if he thinks he needs to actually be seen in person, then he has an officist who only sees the patients based on him pre-screening them. And so that's how their practice is running, is one of them works in the office and one of them purely does telemedicine.
Richard, with all your startups, what are you saying? You see telemedicine going away?
Sure. No, I don't think that's happening. I think on the West Coast right now, people I don't think understand how integrated remote care is actually happening. I have a relative who's an ER physician that is an ER physician from his house. And they ask, how does that happen? Simple. They have a little robot that rolls around with a little tablet. They have a skeletal nursing staff, and the ER physicians, for the most part, are not in person because they're so afraid of them getting sick and COVID. So I think that's just one example of technology. With regards to telemedicine itself, absolutely not. Do I think it's going away anytime soon? I think we will see a drop in overall volume as patients become more comfortable. But I think long-term, it is definitely here to stay. Any numbers that we see long-term are going to be exponentially greater than what they were prior to Q1 of 2020. I guarantee you that. And I honestly think we still have a long way to go when it comes to telemedicine. I was just chatting with the head of Verily for the country of Singapore, and we were talking about solutions that they have there and in other countries throughout Pan-Pacific region when it comes to telehealth. And one thing that they're seeing, and that is a lot of value that we just don't have yet here in the US, is a patient can pick up their phone, push a button, see the doctor, and then knock, knock, knock on the door, medication shows up. That last aspect is something that is missing. And shameless plug here. There's a company that I have a sizable portion of that is looking to solve that very problem. That is deep in discussions with United Healthcare and Humana based on their solution that just launched in November and is already pushing into the 10,000s with regards to volume of prescriptions delivered. So there is just so much more still to be done in healthcare when it comes to remote care. Another thing too is you're seeing a real shift of healthcare from inpatient to outpatient. Look what any of you, I implore you to look up what's happening right now in real time with the Shriners Hospital system. They are literally doing a transformational change with their entire organization of moving patients from inpatient to that outpatient surgical experience. It's something kind of really crazy to watch. Shriners International Headquarters is just down the road from me in Clearwater Beach here in Tampa. And then you look at companies throughout the country, OnMed, and the list goes on and on of organizations that are providing care in home to patients that simply have outfitted cars to go into the patient's homes with an EMT or a nurse prac or a PA or whatever it is, doing that at-home care. I really do see that continuing to ramp over time. That does not mean hospitals and inpatient is going away anytime soon. I just think there'll be additional convenience factors when it comes to play for patients. And honestly, with such a large number of patients not having the transportation ability to even get into clinics these days, I am very, very happy for it, especially when it comes to our underserved populations and our rapidly aging populations as well.
Yeah, I completely concur with both of you. I think the example I would give, companies like Roe, Livongo, you have the tech companies that were kind of pre-positioned, though they were the more progressive companies and they were ready for a time like this, right? Like Zoom. Zoom was just perfect, or StreamYard was just perfect for these kinds of things, and they were able to take advantage of that. And that's where preparation comes in for when you have those kinds of opportunities, and that's part of innovation. But I think that the example that I would give that shows you that this is really more here to stay and become now institutionalized is when you have the larger players that they were always kind of waiting to kind of make these technological leaps, and now COVID forced them to do it. But because now they've done it, now they see the benefits of it, and they understand how they can actually increase marketing and increase kind of efficiencies and decrease costs. So when we have the big players like the Blue Cross Blue Shields starting to make those types of partnerships and starting to do reimbursements like that, that's when I think you can see something that is really making an institutional change. The other example I would give is really the client. So if you have a younger population, you have Tayab, he's a young whippersnapper, and he'll go out and he'll pull out his mobile device and see his patients or see his provider real quick to do his yearly checkup. That's one thing, right? That's a younger generation. But when you have people like my parents who are baby boomers, right, when they're 70, and now they've made the transition, and they're the ones that actually utilize their physicians. Because if you're younger, you might see your physician once a year or once every couple of years, just kind of as a checkup. But when a large chunk of your life is seeing physicians as you get older, and you make that transition of seeing people in person when you're so comfortable seeing people in person, but now you're making the transition that you would do that when you're that main market driver and you see them doing it. I think that's another thing that kind of signals that this is kind of here to stay. We're at the 10-minute mark. We have a lot more questions to go. We'll try to get to as many as we can. Birdie, you want to bring up the next question? Telemedicine again, other tech medicine innovations. How do we see them? This is from Fritz. How do we see rural healthcare or vulnerable communities being affected or being improved by this? Rich, why don't you start, since you kind of mentioned a little bit toward the end of your last question?
Sure. About a decade ago, we started seeing consolidation with regards to healthcare throughout the country. Okay, small community hospitals, rural hospitals getting eaten up by large conglomerates. That's not going to slow down anytime soon. When that happens, what do? They shrink and they contract and they try to have healthcare in one area, provide for a larger geography. That's a problem. This is something that I really like with regards to telemedicine. Patients are having issues with mobility. Patients are having issues trying to get, in some cases, hours away to see their physician. And this is where I really see healthcare going into the future too, is just providing that in-person, at-home care. We have ways now to track vitals at home, whether it's through the phone or through other devices. We have ways you can do your labs from home with companies like My Lab Box and others. You can go to Target and get a box that you can then send in for genetic testing and other types of testing. And I do have to tell you, I'm very, very excited about it. And I think that it's going to stay and really impact those rural communities because they're just not going to go away. People stay in regions sometimes for generations. They don't have that mobility to go up and down when it comes to social strata from an economic standpoint. And all of us need to find ways to provide cares for those patients at equivalent levels that our friends in San Francisco or Austin or Tampa or in Miami are getting. The patient population deserves it.
Tayab? You're on mute, buddy.
You think I get better at that? I'm gonna echo what you said. That was beautifully put. I will say, on top of just getting access to all these folks, I think another thing is you can start integrating a lot of these technologies in. So while you're doing telemedicine visits, you no longer just need to have that family practice physician that's seeing those patients. You can now get an algorithm that can diagnose diabetic retinopathy right there and then. You're getting ophthalmologist level of treatment for a group that, in theory, might never be able to actually get to an ophthalmologist. So not only is it expanding care, but it's also bringing more specialty care more rapidly. So, we have a shortage of healthcare workers in the U.S. Technologies like these are going to help, close that gap that currently exists.
Yeah, I would echo both those sentiments. The whole promise or the nirvana of AI, and one of the things that kind of really drove me to go into the field is that whole concept of democratizing healthcare. The fact that we do have, and we've seen it right now, who has COVID affected the most? It's Black and brown communities. Why? Because there's a disparate level of care. You have systemic inequality that has embedded itself into the healthcare system. And there's been plenty of examples of with machine learning and AI that's actually perpetuated some of that, where it said don't give the same level of care to African Americans as you do to Caucasians. Why? Because that data was already there that African Americans don't have as good of outcomes. So it just kind of perpetuated the data that was there. But once you start fixing those underlying inequalities and you start putting in good data, then you really have the opportunity to get care to people regardless of where they are, not just the United States, across the world. Like doesn't matter if you're in Africa or if you're in Asia or if you're in Missouri, if you're in Utah, if you're in Florida, AI can democratize healthcare and make sure that everyone gets the same level of care regardless of where they were born, regardless of their socioeconomic status, regardless of what language they speak. That's really where technology can move the needle forward for all of us. But we still have a ways to go. And I talked about that lack of data. We still need to get those communities, those underserved communities, whether they be rural or whether they be BIPOC or whatnot. We need to get them into the data sets, and we need to make sure that they're valid data sets that are appropriately represented. The NHS and the European Union is doing a much better job at this than we are. They have way more robust data sets that are very diverse, as opposed to one of our inherent problems here in the US is that we're siloed. Even amongst one healthcare institution, you can have siloed data sets. You go to Harvard, and Beth Israel Deaconess may not communicate with Mass General, and then they might not communicate with Brigham and Women. So even large academic centers like that have this problem of siloed data sets. So still issues that we have here, but you look at companies like MedZoomer, which Richard mentioned, that I also advise at full disclosure, but those kinds of things, you have to think of your patient 360 degrees. It's not just at the point of care. What is their home life like? Where do they come from? What's their work life like? What are the things that are keeping them from being able to get their medications? Those are the things that we sometimes tend to forget because we get so caught up in, break bone, fix bone kind of mentality from medicine. So those are the kind of things that I think is coming down the pipeline that can really make a big difference to rural and low income communities. But we still have a lot of work to do, and we need more MDs being a part of that story. So we're coming to an end here. So I want to ask Tayab and Richard, for our audience, any last words of advice to the medical students that are looking for this, looking to get into this and being inspired by both of your stories. And I want to thank both of you for taking your time to sit down with us today. Tayab, I'll go to you, and then Dr. Munassi, I'll let you close it out. Tayab?
I think one of the takeaways should be that, you're not putting the genie back in the bottle here. AI and tech and medicine is here to stay. It's going to keep getting further and further integrated into clinical practices and workflows. I think those physicians that are going to do the best are the ones who start off by being prepared and understanding how the world works. I mean, I see one of the big promises of AI of getting more equitable healthcare to everyone. Not to say that, there's plenty of bad doctors, let's just be honest. There's at least 250,000 deaths due to not malpractice, but medical errors. If I have a physician that's seeing me, I'd rather they have a smart stethoscope that beats out 90% of primary care physicians in detecting a murmur, rather than, someone out of med school for 2 years who has no idea what they're listening to. But I really think, this is the future of medicine, and everyone should start trying to get as involved as they can. Like Jose and Dr. Munassi both said, there are tons of ways to get involved. The onus is on you to kind of get informed first and then reach out. You gotta sometimes slide into some people's DMs and they will respond. They are more than happy to respond. So just go ahead and do it.
And just keep it appropriate. So what I will say is this: if you think that this is something that you want to do, if you want to get involved in technology with regards to healthcare, if you want to play in this world, don't wait. Everyone always thinks, hey, I'm going to wait. I'm going to practice for a couple of years. I'm going to circle back. Don't do that, because there's never a good time to do this. You have to just go. And that's one of the biggest changes when it comes to technology versus healthcare, the speed at which things move and the ability for you to be fluid with your decision-making, with how quickly you move, with your assertiveness, and then also with your ability to step away from the clinical side of things to focus on what you need to focus on in technology. That is absolutely imperative. The idea that you can play kind of in both worlds. I remember I had a talk with a surgeon. This particular surgeon was trying to convince me that they were the CEO of a fast-growing tech company that had a lot of promise. And as I dug, the surgeon, I asked the surgeon, how many hours are you practicing right now? And they're like, 60. And I said, so you're going to tell me that you can be the CEO of a high-growth tech startup that's going to be worth millions upon millions upon millions of dollars in your spare time, and that you are not going to step away from that role and let someone else who has the background in this world run the show? And they were so adamant that they could do both, that, that never, ever works. And I got to tell you, getting investment and growing your companies to ensure that you can provide your solution to the patient population at scale is a critical aspect to this journey. And no one wants to invest in someone who's going to be spending their money and half-assing it. So that's number one. Number two, as you practice and you move forward, things always get more complicated, whether you have your own practice, whether you have your own surgical centers, whether you have family, so on and so forth. And the truth of the matter is life only gets more complicated as you get older, as more people rely on you too. So just keep that in mind when you're trying to make a decision on how you want to play with regards to technology. It is a difficult route, but I feel the rewards are exponentially greater than from a financial standpoint. And there's a big ability to impact a very large percentage of the patient population with any of the solutions that you build or create. So just keep that in mind too. And no matter which way you decide, no matter how you want to move forward, I'm definitely certain that all of you will be successful along your pathways as long as you take things seriously and keep pushing forward in your journey.
Thank you both. Amazing words. Sorry, we were not able to get to all the questions. They had great questions. We can always access them again via YouTube and try to answer them then. But thank you, everyone, for attending. We really appreciate it. It's been an honor this evening. I'd like to thank again deeplearning.ai for the opportunity, Eastern Virginia Medical School for the opportunity to speak, and for your students coming to hear, and also for Halo Space, our technology partner, who is streaming this across all of their channels. So thank you all, and I hope you have a great evening, and I hope you catch us again for our next Pi in AI. Good night, everybody.